that you're here with us to answer our questions. Dr. Tony Abraham is a neurosurgeon and the migraineur himself. And we're here today to ask him one of the biggest questions that every migraineur goes through, which is, do I have a brain tumor? Before we get into that, Dr. Tony, can you tell us a little bit about your journey with migraines? What did it start with and how has it progressed? What is your typical migraine?
Yeah, my journey with migraines. Okay. I started having headaches probably about maybe when I was around 26 or 27 years old. And it started with a very severe headache. And I was doing my post-graduation at that time. And so I had severe continuous headache with stiffness of the neck, which lasted for almost 3 or 4 days. And at that time, we got worried and we got a scan done to rule out other things. And when everything was normal, well, we felt it was a migraine. And since then, I've been getting headaches every once in a while, but I don't have a very severe form of migraine. Fortunately, I have a very mild form of migraine, and for some time my migraine was in the form of giddiness. I used to just have giddiness and occasional headaches. And again, we had to go through the whole thing of wondering what it could be, and then my neurologist friend who was looking after me, he said, it could be something known as vertiginous migraine, or migrainous vertigo. And I was started on prophylactic medication, that is medication to prevent the frequency of the migraine episodes, and that helped me. And I took medications for about 4 or 5 months, and then I stopped it, and I've never had frequent migraines since then. And since then I've been having I get headaches once a month or maybe twice a month. When they come, they are severe, but my headache responds to paracetamol or acetaminophen, two tablets, and usually my headache stops with that. Occasionally, yes, I have headaches that don't stop with that, and I have to take another dose. But generally, so that it stops with that. So I also sometimes take triptans, another medicine which is helpful in aborting the headache at its beginning. But I'm not on regular medication, and yeah, so I still get headaches, I would say once in 2 to 3 weeks. But yeah, and I just take analgesics, painkillers as and when I get them. Yeah, so that's and I know that migraines can be bad. I know that they can be bad, and I fortunately have a very mild form of it. And I know it can be bad, and I know that it can be very bad. In certain people, it can be debilitating. It can be it can affect your life profoundly in some people. But one thing I can say is that it's not life-threatening. It's not life-threatening, and there are medications that can help people with migraines. Yeah, so that's my story.
Thank you so much for sharing that. Each person's migraine is so unique, and just knowing what other people are going through with their migraines is sometimes extremely helpful. So thank you for that. We'll just move on to the next question, which is the main thing. And that's about how every migraineur, or rather every person who has frequent headaches, wonders at least once in their lifetime whether they have a brain tumor. So in your experience as a neurosurgeon, how likely would you say it is that a person with headaches has a brain tumor?
Okay. I think one thing that has to be very clear and understood is that not every headache is a brain tumor, and at the same time, not every brain tumor presents with headache. Okay. Now, having said that, in general practice or in the general population, headaches are common. Okay, and it has been estimated that around 80% of headaches are benign headaches, which would be classified as tension headaches. Okay, and another roughly 16% would be classified as migraine. Okay, so 80 plus 16 is 96. Right. Yeah. So which leaves only 4% of headaches which are actually dangerous headaches. Okay, life-threatening headaches. Now, so that's something that people need to understand very clearly, that the vast majority of headaches are benign and harmless. Yes, they are a pain. Okay, they're a pain, they are troublesome, but they're harmless. Yeah. Now, having understood that, the question is, do I have a brain tumor? Now, out of this small percentage of so-called dangerous headaches, the number of people who have brain tumors is even lesser. Okay. So when you have a headache, you should not think of brain tumor as the first thing. You should think of a simple headache or probably a migraine as the first thing, and not a brain tumor. Now, having said that, when you have repeated headaches, okay, which are troubling you, there are certain things which indicate that the headache might be a troublesome thing, a dangerous thing. And these are called, what we call as clinicians, we call them red flags. Okay. Yeah. These are things in headache. When a person has a headache and he or she has this certain thing, we consider it as a red flag and would definitely warrant further investigation. Now, some of the red flags, some of the things that we need to watch out for are, is there a disturbance of vision, especially if there is double vision. Is there a loss of consciousness? Is there any kind of weakness or a slurring of speech or any kind of neurological deficit? The other red flags that we need to keep in mind are things like, is there fever? Right. Is it a sudden, the worst headache of my life? Then if the person has HIV or cancer or some other serious illness, and on top of that they have headache, you need to take that seriously. It may not be something benign. Or if headaches start for the first time in an older age group, let's say you're 50 years old and you start having headaches, you shouldn't just dismiss it as, it could be just another headache or migraine or something. Or if there is a change in the pattern of your headaches. Migraines usually have a very stereotypical pattern, and that, okay, I'm going to get that headache, and and it's going to be on one side, or some people have it on both sides, things like that. So if there's a sudden change in your pattern of headache, again, you need to be thinking about going and seeing a doctor. Now, these are all red flags which can be due to many causes. Okay, it could be a subarachnoid hemorrhage, an artery that bursts in your head, or it could be anything. It could be a tumor or anything. But since you asked specifically for tumor, the most important things for tumor are severe headache with features of raised intracranial pressure. Okay, that's what the medical term is. Because a tumor is a space-occupying lesion. The brain is like a box. Okay. Yeah. and it's a box with brain and blood and CSF, and and there's very limited space for anything extra. So when you have something like a tumor, it's an extra space. It's a space occupying lesion, and that increases the tension inside your brain, the pressure inside your brain, and that results in very severe headache with visual disturbances, especially double vision. When you start seeing double, visual disturbances, loss of consciousness, and sometimes fits, seizures. Those are things that are more likely to be pointing towards a brain tumor. Now, at the same time, there are brain tumors also. I have seen so many of them who come with just simple headache, and you only do an imaging, a CT scan or an MRI, and then you find out that they have a brain tumor. Yeah, so not to frighten you, but the things to remember is that a very small percent, the vast majority of headaches are benign. The vast majority of headaches are harmless, and brain tumors form a very small minority of tumors of headaches, and they have these things that I mentioned, these red flags. If you have any of these, yes, you should think of seeing a doctor immediately.
Okay, thank you for that. It's very detailed. So just going off on another question related to what you've mentioned so far. For a person who has headaches for the first time, like for example, when you were 26, you had your first headaches. You went to a neurologist friend and got it checked and had a brain scan. Would you say that this should be the norm for everybody who has headaches? Should they seek specialist opinion and or do brain scans?
Okay, see, my situation is different because I was doing a post-graduation in neurosurgery when I started having the headaches. Okay, so my situation is different. Now, having said that, as an adult, when you start having headaches and you have repeated headaches, and migraines typically are repeated headaches with a stereotypical pattern, which means it usually comes in one pattern. Okay, some people have it at the back of the head, some people have one side of the head, some people have it on both sides of the head. As an adult, it is, I would, and as a clinician, I would advise to have a brain imaging done at least once in your lifetime.
Right.
Okay, because it may be a small percentage of worry, but it's good to have at least one imaging done. So if a person comes to my clinic and says, I have headache and I've been having headache for 2 years or 2 months or 2 weeks, if the person is an adult, and I would say just get a scan done.
Yeah.
And I let me tell you, in my experience, more than 95% of scans are normal.
Right.
But at least it reassures the person that your headache is most likely a migraine. You don't have anything else more serious. And you don't have to repeat and if the headache is the same as what it was earlier, you don't have to repeat, or you don't have to worry about it. You know for sure that there's nothing major happening. So yes, I would advise at least one imaging in your lifetime.
And who is the specialist that they should seek?
You don't have to go to a specialist. I mean, if a general practitioner who knows. See, migraine is very common. Okay, it's not very. It's not as common as a simple headache. Among headaches, migraine is the most common reason for visiting a doctor.
Okay.
So you can go to a general practitioner, or if you want, you can go to a neurologist. It doesn't matter. But I would say at least once get yourself checked, just to make sure that things are okay and there's nothing else happening.
Okay. Yeah. So that's the questions that we have for you today. Thank you so much for answering them. So could you just summarize like the takeaways that a person with migraine who's watching this video should keep in mind?
Migraine is a harmless kind of headache. Okay. It can be troublesome, and it can be very painful in some instances. Now, if you are troubled by a headache, okay, now when I say troubled by a headache, if it is affecting your life in any manner, okay, if it is affecting your daily life, if it's affecting your career, and you're taking leaves very often because of your headache, you should see a medical practitioner, okay, because migraines can be treated, okay. There are very, very few migraines which are difficult to treat. Most migraines, and now some more newer medicines are coming, so migraines can be treated, and I think you should visit a practitioner. And for some people, migraines are mild and just need over-the-counter pain medications like acetaminophen or something else. For people who have headaches very often and it's affecting their daily life or affecting their career, I would suggest that, as a clinician, they should probably be taking regular medications known as prophylactic medications, which I took for a few months to, cut off that cycle of migraines and keep yourself free from it. Reduces the number of headaches that you have. And in most people, they take it for a few months and stop. It doesn't come back like it was before. Some people have to take it for long term. And there are some medicines like triptans, sumatriptans, and earlier there were a group of medicines called ergots, which is not, which are not very, which have more side effects. But triptans, especially, if you take them at the beginning of the headache, it stops the headache for most people, and it's almost diagnostic of migraine. And so I would say, if it's affecting you significantly, affecting your career, affecting your life, please visit a clinician, a general practitioner, or a neurologist, or whatever. You don't have to go to a neurosurgeon, okay? And I would say get at least one CT scan or MRI at least once in your lifetime. And always be aware that if there are any red flags, like I mentioned, if there is a sudden severe headache, loss of consciousness, or a change in your pattern of headache, then yes, definitely you'll have to, visual disturbances, you need to see a doctor immediately. And I would say migraine is not something that, it's a pain, it's a cross that some people have to bear, but it's nothing to lose your sleep over. It's not something that is going to, take away your life. We just have to sometimes grin and bear it and take the medications that help quite a bit. And in most people, they'll be able to live a normal life without any major issues.
Okay. Thank you so much, Dr. Tony.